وبدأ التنحيف وهرمون الرجولة، هل هي الحل السحري؟
So the purpose of a GLP-1 in helping aid in weight loss is that it causes delayed gastric emptying. What that means is that the food stays in your stomach longer and it tells your brain that you're hungry and you don't want to eat anymore. So in turn, when you're eating less, you happen to lose weight. After the age of 30, your testosterone starts to drop by 1 to 3%.
هل يا ترى كل واحد في ياخد الجي ال بي 1 يعني مثل الاوزمبيك لكون الاوزمبيك اكثر واحد مشهور فيهم ولا في اشخاص ممنوع ياخدوا الجي ال بي 1؟ شو بيأثر يعني إذا التستوستيرون ليفل إنه واطي يعني أو منخفض؟
Sexual dysfunction, low libido, these are big deals. And these are topics that are taboo to talk about, but that's a good thing because I like talking about them.
هلا من خلال خبرتك بهذا المجال إنه هودي الجي ال بي 1 بيشتغلوا يعني they work؟ خلينا نقول حدا يمكن عمل عند برايمري كير او اجى لعندك وعمل فحوصات باللابس وطلع معه انه عنده مزبوط انه هيدا الهرمون منخفض، شو بتعملوا بهيدي الحاله؟
You have to remember something. This medication is life-altering. It is life-changing.
بالنسبة للجي ال بي 1 في عوارض جانبية وإذا إيه شو هن العوارض الجانبية وهل يا ترى هن عوارض جانبية أوكي خفيفين ولا لا هن سيريس ولازم واحد ينتبه لهم؟ غير الجي ال بي 1 الويت لوس خسارة الوزن الهرمون ليفلز شو هن الشغلات التانية اللي بتعملوها بالكلينيك هون؟ وبرأ التنحيف أو الجي ال بي 1 مثل الأوزمبيك والمونجارو هل هي فعالة؟ مين في ياخدها؟ شو آثارها الجانبية؟ وهل هي آمنة؟ وأيضا هرمون الرجولة ليش مهم؟ كيف فيك تعرف إذا عندك نقص؟ شو العلاجات المتاحة؟
اسمي سمرة بخدير. I am a double board certified nurse practitioner and I'm also double mastered. I have experience in acute critical care adult gerontology medicine as well as family medicine as well. I have 12 years of nursing experience, 13 state licenses, and I have experience in emergency medicine, urgent care, gastroenterology, primary care. I worked at the University of South Florida's Student Health Services and I was also a clinical instructor for the College of Nursing at USF as well as Florida Southern College.
شو اللي خليك تفوتي بهذا الفيلد؟
I've always had a passion for helping other people. I know that sounds cliche, but I'm the middle child of 3 girls. I've always taken care of other people. My father was in the medical field one time in his life, and he kind of got me into this love for medicine. And my mother also was super caring, and she advised me to go into the nursing field. And since then, I've just taken off, and I absolutely love what I do.
قلتي لي عندك لايسنس ب 13 ستيت يعني مرخصة إنه تشتغلي ب 13 ستيت وعم تفكري توسعي أكثر وأكثر
ستيت؟ absolutely.
شو الهدف؟ شو الجول؟
To be licensed in every full practice authority state in the nation. There's about 25 or more states and I am halfway through and I'm going to get all of them. I want to be able to practice in all of the states I'm able to practice in autonomously without a medical director, so I'm able to provide medical care for as many people as I can for affordable rates and give people access to healthcare.
حضرتك فايتي بمجال مش كتير عالم بيفوتوا فيه، يعني مجال هو الويت لوس التستوستيرون بس بدي بلش اذا ممكن بالخسارة الوزن اللي هو الويت لوس اللي هو هيدا البيج توبيك هلا حاليا عم ينحكى عنه بامريكا كلها خاصة بعد الميديكيشنز الجداد اللي طلعوا بعتقد بتسمون جي ال بي 1. طب اللي ما سمعان فيهم ما بيعرفون شو هو الجي ال بي 1؟
GLP stands for glucagon-like peptide. GLP is a hormone that you and I already produce in our body. It's produced in our gut in response to food. So it helps with blood glucose regulation, insulin secretion, it helps with digestion, and so much more. It helps the pancreas release insulin, and it helps suppress the release of glucagon, which is another hormone. And glucagon is responsible for helping the liver release glucose stores. So that's why, glucose gets into the bloodstream, and then obviously why insulin also gets into the bloodstream as well from the pancreas. So that's why it was FDA approved for type 2 diabetes in 2017, Ozempic and Wegovy. Zepbound and Mounjaro came after that in 2022, and it was FDA approved. After they started giving it to type 2 diabetics, they realized so many people were losing weight drastically. It was crazy. It became a worldwide thing at that point. And so the FDA approved Ozempic and Wegovy in 2021 for medical weight loss. And then in 2023, it approved Mounjaro and Zepbound. So the purpose of a GLP-1 in helping aid in weight loss is that it causes delayed gastric emptying. What that means is that the food stays in your stomach longer and it tells your brain that you're hungry and you don't want to eat anymore. So in turn, when you're eating less, you happen to lose weight. There are so many different types of GLP-1s on the market. Okay. There's Ozempic, Wegovy, Mounjaro, Zepbound, Trulicity, Saxenda, Victoza, and they're also in clinical trials for newer GLP-1s. They keep producing more, and I feel like this is going to be great in the healthcare world.
طب هودي البراندز اللي ذكرتيهم كلهم بيشتغلوا بنفس الطريقة ولا لا؟
Similarly, they're a little bit different. Obviously Zepbound and Mounjaro, they're also GIP and GLP-1s. GIP stands for insulinotropic polypeptide. It's just an extra peptide, actually clinically proven through clinical trials and studies that it's better and more effective in weight loss than Ozempic and Wegovy. There's also oral semaglutide tirzepatide. It's called Rybelsus is the oral version, and that can also be taken orally. So these GLP-1s are given once a week in a subcutaneous fatty area. It's very easy to do. The insulin syringe is so incredibly small. The needle is so tiny. It's so little. And so many people are afraid of injections, but honestly, this one is so tiny that I always tell patients you don't have anything to worry about.
في لحاله الواحد هو ياخدها ولا لازم دكتور يعمل له اياها؟
When I order GLP-1s for my patients, it's all patient specific. It goes straight to the patient. They do it at home by themselves. They're welcome to come in here and have me inject them. Okay. They will be bringing in their own patient specific vial. Okay.
غير الجي ال بي 1 والويت لوس خسارة الوزن، شو هن الشغلات الثانية اللي حضرتك بتعمليهم؟
We also offer testosterone replacement therapy and men's health. So the easiest way I can describe this is that a female and a male's hormones will always start to decline after a certain age. And everyone has heard about menopause, but have you heard about andropause?
لا.
No, right? It's a stigma. Not a lot of people talk about it, and not a lot of people test testosterone levels. So andropause is basically the male version of menopause. This is inevitable. You're going to go through andropause and I'm going to go through menopause.
بأي عمر بتصير للمان؟
After the age of 30, your testosterone starts to drop by 1 to 3%. Andropause will happen at a different age for every man, just like menopause happens for a different age for women. It's when we stop our periods and our hormones start to decline. Same thing with men. Your hormones will start to decline. With our testosterone replacement therapy program, we test your hormone levels out because there are so many men who go through their whole entire life without checking their hormones. It's not a normal thing for primary care to even look at. So that's where I come into play. I will check your hormones for you. I will see if you have low testosterone, if you have hypogonadism, which is low testosterone, what type of hypogonadism you have, what type of symptoms you have, and if you are a good candidate for TRT.
شو بيأثر يعني إذا التستوستيرون level إنه واطي يعني أو منخفض؟
The symptoms of low testosterone, it varies from client to client, but the big ones are obviously the fatigue and the lethargy, the low motivation, no desire to get out of bed to do things, hair thinning, low muscle mass, truncal obesity, depressed mood, and obviously sexual dysfunction, low libido. These are big deals. And these are topics that are taboo to talk about, but that's a good thing because I like talking about them.
خلينا نقول حدا يمكن عمل عند برايمري كير او اجى لعندك وعمل له فحوصات باللابس وطلع معه انه عنده مزبوط انه هيدا الهرمون منخفض. شو بتعملوا بهيدي الحالة؟
We obviously ask a thorough history of the patient. What are your symptoms? What is your medical history? Is there something that could be causing the testosterone deficiency? We also look at other hormones, DHEA, prolactin, and a couple of other things as well in your blood work to determine what best treatment options we have. Testosterone comes in many different versions of ways we can give it. Obviously, the gold standard is injections. You could do it in the fat or the muscle. Okay. You can also do it by topical route, cream or gel. You could do it by oral route, by pill. You could do it by pellet therapy. Pellets are when you insert it underneath the skin. There's also a buccal option where you can put it inside of your inner cheek. The two ways that I like to offer it the most, because I know it's the most effective, is obviously injections and by topical route.
ودغري بيشتغل يعني على الشخص ولا بتاخد وقت؟
It works instantaneously, but like I previously said, everything good comes with time. So the way that we like to start is by, giving the injections or giving the topical route. And then after 10 weeks, we do your first lab draw. We want to see if it's effective. We want to see if it's working. And then, at that point, we're going to continue to give you the testosterone, and then we'll do labs again in 3 months. And we'll determine if your dose needs to be increased or decreased based on what your level is, based on what your symptoms are. It can take months to really dial in and stabilize someone's testosterone levels. It could take about 6 to 9 months.
Okay.
And you also have to remember that there comes a period of time, usually after 3 months, that your natural testosterone production is going to stop.
Oh, wallah.
Your natural production will stop, but you don't have to worry. I will keep giving it to you, and I will get you to a level that's highly desirable, and also it's very achievable.
قبل ما نكمل بحديثنا ومعلوماتنا المهمة جدا، خليني اتشكر داعمي رحلتنا إلى ولاية فلوريدا الأمريكية، كل من العقاري نور المصري، توب مورجج كومباني أليكس دهيني، مكاتب المحامية جومانا كيروز، أحمد خضير المدينة سيرفيسز، ومطعم دارنا بباترسون نيوجيرسي. هلا خلينا نكمل. هل يا ترى كل واحد في ياخذ الجي ال بي 1 يعني مثل الاوزمبيك، لكون الاوزمبيك اكثر واحد مشهور فيهم، ولا في اشخاص ممنوع ياخذوا الجي ال بي 1؟
The patients that are not allowed to take GLP-1s are those with a personal and family history of medullary thyroid cancer, endocrine neoplasia syndrome type 2, a history of pancreatitis, gallbladder disease, patients that are breastfeeding or pregnant, patients that are type 1 diabetic, patients that have gastroparesis or kidney issues. Not everybody can take a GLP-1. Majority can, but obviously with a really good, thorough medical history from your provider, we're going to be able to determine if you're eligible or not.
هلا من خلال خبرتك بهذا المجال انه هودي الجي ال بي 1 بيشتغلوا يعني they work؟
Absolutely. They work amazingly.
فيك تعطيني لك من الكلاينتس او من البيشنتس اللي بيجوا لعندك، فيك تعطيني لك ستوريز او قصص انه كان وزنهم هيك صار هيك من ورا؟
Yeah. My highest losing weight loss patient lost about 80 or so pounds. That's the highest. The average is 50, 60 pounds, typically with the GLP-1s. It depends on how long they are on it, obviously. It starts to work between months 3 and 4 because of the dose increase. But if you're on it between months 6 through 9, you're going to see tremendous results.
Wow. طب غير الويت لوس انا سمعت في لها benefits تانيين.
Absolutely.
شو الفوائد التانية؟
Besides weight loss and besides helping out with, obviously type 2 diabetes, GLP-1s have so many benefits, such as cardiovascular benefits, heart benefits. It helps with metabolic disorders, fatty liver, lipid profiles like triglyceride levels and cholesterol values, PCOS, which is polycystic ovarian syndrome. It helps with insulin resistance, insulin sensitivity, and hormonal imbalance.
بالنسبة للجي ال بي 1 في عوارض جانبية، وإذا إيه شو هن العوارض الجانبية، وهل يا ترى هن عوارض جانبية أوكي خفيفين ولا لا هن سيريس ولازم واحد ينتبه لهم؟
Of course there are side effects to every medication. There are side effects to Tylenol, right?
صحيح.
The main side effects to GLP-1s are usually GI issues such as nausea, vomiting, constipation, and acid reflux. Those are the symptoms that I hear about more often than others, but a lot of my patients do not experience those symptoms. And if they do, I know how to tackle them. I'll give them something for nausea, I'll give them something for acid reflux. It can be prescribed or it could be over the counter. Ozempic face or, losing weight drastically is something that we try and prevent. It's not healthy to lose 10 to 20 pounds per month. That's not normal. We lose it over a steady period of time. And that's why I was telling you, months 3 and 4, you notice a good chunk of weight loss. And by months 6 through 9, you're going to notice a huge amount of weight loss by that time. Everything takes time. All good things come with time. You can't expect something after 1 week. That's not how it works. This is a journey. And we're going to be working together through this journey.
خلينا نقول نحن انتم عندكم هدف لازم توصلوا له، جول، وصلنا لهذا الهدف. خلينا نقول شخص بده يوصل ل 40 باوند او 50 باوند انه يخسر، وصلنا لهذا الهدف. يوجولي قديش بتاخذ يعني 6 اشهر 9 اشهر الافريج؟
It starts to work immediately with the suppression of appetite, right? So immediately that first week, you're going to notice something. You're going to notice that you have no appetite. You really just don't have any cravings. You have food aversions, which means the things that you used to crave You don't really crave any more, especially with that dose increase. It gets even more stronger for
بتبلشوا
you.
بدوز صغيرة وبعدين بتصيروا تعلوا الدوز.
We have to.
Okay.
If you start out with a very high dose, the patient can experience side effects, and that's what we're trying to avoid.
برافو.
We start something very slow and low, and then we work our way up to a higher dose, and that's how we achieve the best results.
هل يا ترى لازم يعني مع هود الجي ال بي 1 الشخص يعمل رياضة يعمل ورك اوت ولا you don't have to?
Actually, the GLP-1 therapy is recommended that you also involve a good exercise routine, cardio, and you can do weightlifting as well, along with diet management. So remember, this medication also causes muscle wasting, GLP-1, so we really want to work with our patients to do weight training so that they can build muscle. We also focus on the diet portion where we increase their protein intake. Protein is super important in the dieting world. You should be eating 1 to 1.5 grams of protein per kilogram. It's individual. My kilogram weight is different than your kilogram weight. Protein is extremely important in muscle building, but also energy. So we want to focus on a high protein diet, a very low carb diet, low carb meaning 40% of your calorie intake, and an absolutely zero sugar diet. We work with a dietitian at Everchanging Wellness, alhamdulillah. So we're able to provide patients with diet tips and tricks every month.
آخر شيء بالنسبة للجي ال بي 1 كثير العالم تسمع إنه غاليين. يعني they're very expensive. مزبوط؟
Yeah.
فيك تحكينا شوي إنه هل يا ترى إنه الانشورنس تأمين covered؟ هل يا ترى اللي عنده ميديكيد أو اللي عنده private insurance أو إنه هل يا ترى في payment plan؟ احكيني عن الpricing please.
Healthcare in America is tough. Everything is expensive. Healthcare in America is super expensive. What we try and do is if a patient wants to try their insurance first, I am more than happy to run their insurance. More times than none, it will get denied. If you are not a proven type 2 diabetic or if you don't have specific medical problems.
Okay.
You can call ahead of time and ask them what is covered at what dose and how often or how long can I get it. Some patients that come to me and say, it covers this, let's try this. Sure, I'll go ahead and try and prescribe it. Let's see if your insurance covers it. I'll even do a prior authorization for you. But if it gets denied, then we're going to have to figure out ways that we can get it for you. And although, yes, it may be considered high price for some individuals, you have to remember something. This medication is life-altering. It is life-changing. The same way that someone will go to a hair salon for extensions or hair dye to take care of themselves, or for Botox or aesthetics or anything like that. This is something that you're doing to take care of yourself, to make yourself beautiful. Long term, with weight loss, you're also benefiting your life long term. You're becoming a better, healthier version of yourself. You're going to live longer, you're going to feel better.
هلا عندكم انتم عاملين مثل deals وبندلز وهيك شغلات.
We do.
فينا نحكي عنها؟
Yes. Our program bundle deals include, obviously, the provider consultation. It includes labs, blood work, which is a big deal. It includes medication, supplies, and shipping, and it includes the dieting protocols with our dietitian. So it's a full program bundle deal. There are no hidden costs and fees. Once you pay for it, once you pay for the vial, that's what you get. That's the entire thing. So you get all of that with our pricing, and that's for both packages of the Ozempic, Wegovy, Zepbound, Mounjaro, and then the generic versions as well.
غير الجي ال بي 1 الويت لوس خساره الوزن الهرمون ليفلز شو هن الشغلات الثانيه اللي بتعملوها بالكلينيك هون؟
So we also do urgent care virtually, and I am licensed in 13 different states, and I'm able to see patients in these states.
شو هن بعض هيدي الولايات؟
Florida, Colorado, Iowa, Nevada, Wisconsin, New York, Texas, Illinois, Oregon. I'm planning on getting all of the full practice authority state licenses so that I can offer as many things as I can for patients. Now, remember, testosterone is controlled. It's a controlled substance. So at the moment, we only offer that in Florida.
Okay.
But we can offer other things nationwide.
الويت لوس خساره الوزن هيدي فيك تعطيها بولايات ثانيه؟
Yes. We can offer the GLP-1 therapy. We also offer other medical weight loss, weight loss solutions like oral stimulants, phentermine, phendimetrazine, diethylpropion, casemia. We offer offer non-stimulant drugs like Contrave and Metformin, and we offer specialty drugs. So depending on if I can prescribe it out of state, I will. I prescribe in other states GLP-1s all the time. And then with urgent care, same concept. We treat a variety of different conditions: UTIs, COVID, influenza, sinus infections, birth control, medication refills, anxiety, hypertension. Doing this for a while, doing this for many years has given me the confidence and the ability to treat you virtually. I'm licensed and I have prescribing authorities in each state. The reason I started urgent care is mostly because of the healthcare disparities and the lack of healthcare in our community, especially the Arab community, but mostly like every community. There's so many people that don't have health insurance. There's so many people that do not go see a doctor, don't have transportation, that can't leave the house, are fearful from seeing a provider. There's so many barriers to getting medical care. So being seen virtually over a telephone, a computer, a tablet, it helps them see a medical provider. It's easy, it's effective, you don't have to wait in a waiting room full of sick people. And the beauty of this is that we don't take insurance. It's all cash pay, but we do it at such an affordable rate for these patients.
كنت رح أسألك سبقتيني يعني.
That they don't have to ever worry about a healthcare bill from the hospital. So many people go to the ER because they don't have a primary care doctor. They don't want to spend money, so they go to the ER. The ER waiting rooms are 8 to 9 hours. When this patient just has a common cold, it's no emergency. They don't want to be surprised with a medical bill.
صحيح. يعني أنا كتير مبسوط صراحة بالمعلومات اليوم. تعرفت على كتير أشياء كنا نسمع فيها يمكن نقرأ عنها بس بشكل سطحي. يعني أنا شخصياً استفدت، ومأكد كتير عالم عم بيحضروا هذا الفيديو عرفوا شو هو GLP-1 وشو هيدا أوزامبيك وشو هيدا ويت لاس، وكمان قصة الهرمون. أنا بعتقد كتير عالم ما بيحكوا عنها، يمكن بيستحوا يحكوا فيها، بس هيدي الكونفرزيشن يمكن بلشناها نحن اليوم. فبدي أتشكرك. كلمة أخيرة منك دكتورة، إن كان للي عم يحضر الفيديو أو للجالية بشكل عام.
I am ready to help you become the best version of yourself, whether that's with medical weight loss, if that's through urgent care services, if you're sick and if you need help, or if you are a male that's interested in testosterone replacement therapy. I am your girl, I am your clinic, and I am here to help you. If you say that you are referred from What's Up Media and you saw me on this video, let me know so I can help you out with a discount.
شكرا لك على معلوماتك. أنا مأكد كتير عالم تعلموا شيء جديد اليوم. أنا من الأشخاص اللي اليوم صراحة تعلمت أشياء كتير جديدة. مجددا شكرا لك دكتورة لوقتك ولمعلوماتك. متابعينا ومشاهدينا، هيدا كان الفيديو تبعنا معلومات في غاية الأهمية. اعطونا رأيكم بالمعلومات اللي شاركناها بمربع التعليقات، اعملوا مشاركة لهذا الفيديو على أوسع نطاق. أكيد إذا حابين تتواصلوا مع الدكتورة والعيادة، الرقم والمعلومات موجودين بأسفل الشاشة وأيضا بمربع الوصف. هذا كان الفيديو تبعنا، كان معكم حسين هاشم. ما تنسوا تتابعونا على وسائل التواصل الاجتماعي، لايك وفولو على فيسبوك انستغرام وتيك توك وسبسكرايب على يوتيوب. كان معكم حسين هاشم وفريق عمل قناة الأخبار من تامبا فلوريدا. إلى اللقاء.